The Center for Unhindered Living presents Plus Size Polyamory with Judy McMath. Episode 10 with Dr. Alison Fry, Sexual Health and Hormones. Hey everybody, we're back today, and just as I promised you yesterday, we're here to talk with Dr. Alison Fry about hormones and sexual health. But first, before we get to our subject, I do want to remind you to go over to our podcast website and become a patron of our broadcast. You can become a patron for as little as $1 a month, and you can get some neat patron benefits for that. So just go to pspolyamory.podbean.com, and at the top of the page there is a Become a Patron button, and you can click on that and then follow the instructions there. And thanks for your support. So Dr. Alison Fry is a board-certified family physician who joined Peak Med Primary Care here in Colorado Springs in January of 2016. Dr. Fry enjoys the full spectrum of family medicine and has a special interest in employer-based health and wellness. Dr. Fry received her medical degree at Rush Medical College in Chicago in 1994. She then moved to Arizona for her family medicine residency with Good Samaritan Regional Medical Center in 1994 and received the Family Practice Resident of the Year Award as a senior resident. After completing her residency, she worked with National Health Service Corps at community health centers in New Mexico and Arizona. Since working in community health, Dr. Fry has worked in a variety of practice settings, including private practice, urgent care, employer-based health centers, and hospital-based practices. All of these experiences have led Dr. Fry to find a better way to practice medicine. She believes in spending time with her patients and building relationships, and feels that direct primary care model best allows her to care for her patients. So thank you for being here today, Dr. Fry.
Well, thank you for inviting me.
So just a little bit about Peak Med. Peak Med is a direct primary care practice which provides care to individuals and employees from local businesses, large and small. They're a membership-based practice that does not bill insurance, but rather charges a monthly membership fee, approximately $79 a month for adults. This fee entitles the patient to have direct access to a medical provider. There's no copays for appointments. Peak Med has a small pharmacy and offers medications at a discounted price. They're also able to offer labs at discounted cash prices as well, or you can bill your insurance if desired. Peak Med has 3 Life Center locations here in Colorado Springs: the Tejon office downtown, the Northgate office at Northgate and I-25, and the Tut office at Tut and Woodman Road. For more information on that, you can go to their website at peakmed.com. So just a little word about how I got the idea for this. I experienced, when I was around 50 years old, I experienced a real shift in the way my body felt, and I thought that I might be experiencing those low hormones. And my husband and I are polyamorous, and we're involved in a number of polyamorous groups here in Colorado Springs, and I noticed that in these groups there were only people in their 20s, 30s, and 40s. And I thought, where are the 50 and 60-year-olds? And then I thought back to when I was around 50 and how I think that my hormones just took a nosedive during my 50s. And I thought to myself, maybe this is the reason why people are not wanting to get into relationships or not wanting sexual relationships, or they just feel too tired, or whatever the case may be. When you enter your 50s, things change. And so I wanted you to talk a little bit first about when do our hormones peak and when do they start to decline, at what ages?
Yes, and keep in mind it is different for each individual, but generally your hormones are going to peak somewhere in your early to mid-30s and then start declining after that.
Oh, that's a lot earlier than I thought.
Yes, and certainly people will start noticing those symptoms more in their 40s and certainly in their 50s and 60s.
Right. I think I started noticing them mid-40s, but they were so minor that I just didn't worry about it.
And typically it happens gradually. So
right.
It may take a while to really say, aha, I think this is what's happening.
Right. Now, is it the same for men and women?
In terms of the age, approximately,
right.
Yes.
Okay.
Yes.
Okay. So what would be some of the symptoms of low hormones?
So one of the obvious things is certainly a change in sex drive or certainly change in sexual function. But there can be a variety of other symptoms. Fatigue is probably one of the most common symptoms. Sometimes, particularly in women, we'll see things like mood instability. You may feel more anxious, more depressed, may cry more, just kind of the typical hormonal fluctuation type mood symptoms. Certainly there can be sleep disruption. You can get deterioration in your muscles and also starting in your bones as you get older and your hormones decrease. You'll see changes in your skin and your hair as well. Sometimes we start losing hair where we'd like there to be hair.
Right.
And growing hair where we'd like there not to be hair.
Yes.
So there can be a variety of symptoms.
Okay. So those sound like mostly symptoms for women. What would the symptoms for men be the same?
Well, and men can have many of the same symptoms too. They can also start seeing change in their sexual function, their sex drive, their energy, also with their sleep. And men, like women, can also develop some hot flashes.
Really? I've never heard of that.
Yes. And we call it menopause.
Oh, okay.
Instead of menopause.
Okay. Well, yes, I don't remember having hot flashes, but I do remember just being hot all the time.
Yes.
And now, we're talking about sex hormones here. What about thyroid hormones? Do they also take a dip during those years?
Yeah, often as people get older, people who are on thyroid replacement may need to increase their dose of replacement because as they get older, their thyroid starts, not producing as much natural thyroid as it would.
Okay.
So yes, that can also take care of the change.
Because it was always a toss-up for me. Was it the low thyroid or the sex hormones causing my hair to fall out? I was never sure.
And sometimes it's both, and the symptoms can be similar.
Right. So do you actually see that people's hair grows back when they get on the right therapy, or no?
Not typically.
Not typically. Once it's gone, it's gone. Sorry.
And I want to be clear. I mean, I'm all for hormone replacement, but it often isn't the magic bullet that people think that it's going to be. It certainly can be very helpful and very beneficial.
Right.
But there are just certain things that change as we get older.
Right.
And one of the conversations I do have with patients when we do have that initial conversation about menopause or hormone replacement is, this is a natural part of aging. You don't have to do anything about it.
Right.
A lot of people choose to do supplementation and hormone replacement because it may make them feel better.
Right.
And they may not be happy with the quality of life.
Right. In my husband's particular case, when you have permission to discuss his case, his testosterone was almost zero.
Yes, I've never seen anybody's testosterone as low as his testosterone.
Right. And so he has benefited tremendously from supplementation because he had nothing, basically. Now, if you have at least some, you might not think that you really need it. But in his case, we really thought he needed it.
Yes.
So, and he has benefited from it greatly. So, okay. So discuss some of the treatments that are available.
Okay, well, let me back up just a little bit. So if a patient was coming in to me for the first time to talk about it, I would generally start with some basic labs just to kind of verify that that is truly what's going on and that there isn't anything hiding in there that may be creating symptoms that is something other than just natural decline of the sex hormones. Once we've done that and kind of evaluated for that, there are different options for hormone replacement. So you've probably heard about bioidentical hormones.
Yes.
Basically, those are plant-derived. The chemical structure is equivalent to the structure of your natural hormones. So they're considered natural hormone replacement. And then there are synthetic hormones that's also available. Honestly, I use that very rarely. I typically will only prescribe those if someone's been on that forever, they're having no problems and want to continue that. But generally I try to do more natural hormones, whether it's going a compounded route or whether it is going through, a regular pharmacy.
Right.
You can get some natural estrogen and progesterone through a regular pharmacy as well.
Okay.
And then you have different options in terms of, some people like lozenges, some people like creams, some people prefer pills. There are shots for particularly like testosterone. Those are different options. And all of them have benefits and disadvantages. So a lot of it is on personal preference. Hormone replacement is not cheap.
Right.
So if you are paying out of pocket, sometimes that can be a limiting factor, particularly with some of the compounded hormones.
Right. Okay. And do women need to have their testosterone checked as well as men?
It's up to them, but I usually will get a baseline of that. A lot of it depends on their sexual function. Certainly, women probably a little more frequently than men will have libido issues earlier on and may find that they have issues like vaginal dryness that can make sex uncomfortable for them. So there can be a variety of things going on. And also just not sleeping well, being moody, feeling tired, all those things can impact your sexual health as well.
Of course. Yes. Okay, so in my husband's case, he used the testosterone gel, and it only took a couple months of him using that for me to notice a difference in him. So that was very helpful. Now, you told me that you had used hormone therapy yourself for several years. What do you use?
I just used estrogen and progesterone.
Okay.
And I just take a pill for those.
Okay.
A low dose of a pill.
Okay, great. Okay. So let's see. What should someone do? What should be their first step then? Should they try some over-the-counter remedies first, or should they?
Certainly can, but the problem with a lot of the over-the-counter stuff is that it may be very expensive and not very effective. A lot of the over-the-counter supplements are not regulated, so you never really quite know what you're getting when you buy a product.
Right.
If you have a friend that's using something that's had really good success with it, yeah, it's definitely worth trying that.
Okay.
But often you're probably going to get more benefits from a prescription hormone replacement than you are some of the over-the-counter stuff.
Okay. And would your pharmacy here at Peak Med have those in stock, or could you
We do not. We do not carry any hormones here in stock. And testosterone is a controlled substance, and so those have to go through the outside pharmacies.
Okay. Okay, that's good to know. Great. Okay. Well, is there anything else you'd like to add that we haven't covered?
No, I don't think so, not in terms of the hormone replacement. Again, I just encourage people to have a discussion with their provider to review their options to make sure that they're healthy for hormones, whether that be heart health or just general gynecological male health issues. Make sure all that is in good shape. So discuss that with your provider, and then have a conversation about what options might be available. What are your personal preferences, whether you want to do something like a pill, a cream, an injectable, what is your ability to pay for those kind of things.
Right.
And then, of course, you'll need some follow-up with your provider, to make sure that the dose is working for you. And then once you're on hormone replacement, certainly you do want regular follow-ups for preventive care as well.
Right.
So, for example, women should have mammograms typically yearly when they're on hormone replacements. You want to stay up to date with current PAP guidelines. Men, if they're on hormone replacement, you'll want to follow their levels as well as do screening for prostate cancer and so forth. So all those things are very important, and it's a team approach when you're dealing with hormones between your provider and the patient.
Right. So are there any conditions that you might have that would rule out you being able to use hormone therapy?
Yes, certainly. If someone is not heart healthy, you'd want to be very careful about that in terms of some of the hormones can increase the risk for blood clots. So if there is a history of deep venous thrombosis, pulmonary embolism, certainly that can impact your decision whether to do therapy or not do therapy.
Right.
Certainly if there's a prior history of cancer, breast cancer, prostate cancer, all those things you want to have a conversation. And that doesn't necessarily 100% rule out doing hormones, but you have to understand that certainly that might increase your risk, and you have to make an educated and informed decision and provide your consent for that. Right. Knowing that there is an increased risk if you do decide to pursue hormone therapy.
Okay. Well, that pretty much covers it, I think. Thanks so much for being with us today.
Well, it's my pleasure.
Yeah, and I hope that everybody will come and check out Peak Med. You can go to their website at peakmed.com and check out whichever location is closest to you. And thanks for being with us today.
Thank you.
Hey guys, I just remembered that I forgot to mention Peak Med can also help you meet your needs for STD testing. They can do a panel of tests for you, and they will draw the bloods right there in their office and send them out to a lab, and you can pay the cash price, or you can have the lab bill your insurance. So I did forget to mention that when I was talking with Dr. Fry, but I wanted to let you know that they also have those STD testing labs available for you to utilize. So thanks for listening and have a great day.